If you have stomach problems such as bloating, reflux or belching and stomach pain, indigestion, inflammation of the stomach, abdominal pain, anorexia, this video is for you. The problems I mentioned are mostly caused by human infection with H. pylori bacteria. In this video, several questions will be answered in this regard. First, what is H. pylori bacteria and what are its characteristics? Second, how does it infect humans? Third, from what food sources it is transmitted to humans? Fourth, what are the signs or symptoms of people who have this bacteria? And fifthly, what problems does it cause to humans? And finally, what is the best herbal and home treatment for this disease? Do not miss the video because it has very important content. 1. What is Helicobacter pylori? Helicobacter pylori is a spiral-shaped, gram-negative bacterium that lives in the stomach and duodenum of humans. This bacterium is able to survive in the highly acidic environment of the stomach because it produces an enzyme called urease that converts urea into ammonia and carbon dioxide. Ammonia alkalizes the environment around the bacteria and protects it from stomach acid. This bacteria can penetrate the stomach mucosa and cause inflammation and damage to the stomach tissue. Helicobacter pylori is one of the most common bacterial infections in the world, and it is estimated that half of the world's population is infected with it. Although most infected people have no symptoms. This bacterium is the main cause of many digestive diseases, including stomach ulcers, gastritis, and even stomach cancer. The identification of Helicobacter pylori as the cause of gastric ulcer revolutionized the treatment of this disease and led to the use of antibiotics to eradicate it. Without treatment, Helicobacter pylori infection can remain in the body for years, increasing the risk of developing serious digestive problems. 2. How does it infect humans? The exact mode of transmission of Helicobacter pylori is not yet fully understood, but it is believed to be transmitted mainly through the oral-oral and fecal-oral routes. This means that direct contact with an infected person's saliva or consuming contaminated water or food can lead to infection. Poor hygiene, crowded living conditions and limited access to clean water are risk factors for this infection in developing countries. Since children are more exposed to these factors, they're more likely to be infected with Helicobacter pylori, and this infection can remain in them until adulthood. Studies have shown that in families with poor hygiene, the possibility of bacteria transmission between family members is higher. 3. From what food sources is it transmitted to humans? While the exact mode of transmission of Helicobacter pylori is not fully understood, evidence suggests that contaminated food and water play an important role in the transmission of this bacterium. Specific food sources directly linked to H. pylori transmission have not been definitively identified. But consumption of contaminated water and raw vegetables that have not been properly washed can increase the risk. Also, the use of human manure in agriculture can cause the contamination of agricultural products with this bacteria. Observance of personal hygiene, careful hand washing before eating and after using the toilet, as well as ensuring the hygiene of drinking water, are among the ways to prevent the transmission of this bacterium through food sources. 4. What are the signs or symptoms of people who have this bacteria? Most people infected with Helicobacter pylori have no symptoms. However, in some people, the infection can lead to a variety of symptoms, including abdominal pain or burning. This pain is usually felt in the upper abdomen and under the ribs and may get better or worse with eating. Flatulence, feeling of fullness and wind in the stomach. Nausea, unpleasant feeling and desire to vomit. Vomiting, expelling the contents of the stomach through the mouth. Unexplained weight loss, due to digestive problems and loss of appetite. Frequent belching, the body's attempt to expel stomach gases. Anorexia, decreased desire to eat. Black stool, which indicates bleeding in the digestive tract. Fatigue, due to reduced absorption of nutrients. 5. What problems does it cause to humans? Helicobacter pylori can cause serious health problems in humans, including gastritis, inflammation of the inner lining of the stomach that can lead to pain, burning, nausea and vomiting. Stomach and duodenal ulcer, ulcers that develop in the wall of the stomach or duodenum and can cause severe pain, bleeding and even perforation of the stomach. Stomach cancer. Chronic Helicobacter pylori infection is one of the main risk factors for stomach cancer. Mallett's lymphoma, a rare type of cancer that develops in the lymphatic tissue of the stomach. Other digestive problems, such as indigestion, bloating and abdominal pain. Failure to treat Helicobacter pylori infection can aggravate these problems and significantly reduce a person's quality of life. 6. What is the herbal and home remedy for it? Treatment for Helicobacter pylori usually includes a combination of antibiotics and stomach acid-reducing medications prescribed by a doctor. However, some herbal and home remedies can be used as adjunctive treatment and to relieve symptoms. Some of these methods are Manuka honey. It has strong antibacterial properties and can help reduce the growth of Helicobacter pylori. Broccoli contains a substance called sulforaphane, which can have antibacterial effects. Ginger can help reduce inflammation and relieve digestive symptoms. Garlic. It has antimicrobial properties and can be effective in inhibiting the growth of Helicobacter pylori. Green tea contains antioxidants and compounds that can help improve the health of the digestive system. Olive oil has anti-inflammatory and antibacterial properties. Probiotics can help maintain the balance of beneficial bacteria in the digestive tract and improve digestive symptoms. It is important to consult your doctor before using any herbal or home remedies, especially if you are taking other medications. Also, remember that these methods cannot completely eradicate Helicobacter pylori and the main treatment is still the drugs prescribed by the doctor. I hope this explanation was useful for you. If you have any other questions, you can ask.